A sheriff's department in California is the latest law enforcement office to take an alternative approach to mental health issues. By the end of the year, Nevada County, California deputies will team up with licensed therapists when responding to non-criminal mental health calls. The goal is to reduce the risk of deadly confrontations with people who are in genuine distress. And we are joined now by the sheriff of that county, Shannon Moon. She is in Nevada City, California. Sheriff, thanks so much for being with us.
Thank you so much for having me.
So explain to our viewers, how did this program come about?
Well, we're starting to see a lot of this shift, I think, nationally and regionally, just to provide a little bit more of a robust service for law enforcement. We've definitely had the traditional 911 call for service, deputies response. We're pretty much limited with the services that we can provide. So just looking at it a little bit with more of an open mind on really what is the best service that someone could receive when they're in that mental health crisis.
Yeah, this is one of the conversations we've been having nationally about, what is the role of police, and is it fair to have them fielding a lot of calls that really have to do with mental health? And even though they're trained, there are people who spend their whole careers trained to deal with mental health crises. But when I was sort of learning about this program, my first thought was, well, how does it actually work on the ground? Who takes the lead? There's a 911 call, someone's in distress, a therapist and a police officer shows up, and then how do things unfold, or is that how it happens?
Well, currently the way it happens is it's just that deputy sheriff for our agency, and we're in a rural area in Northern California. So, looking at it as how best can we provide services for someone in distress. So a lot of times what that deputy response is they take the consideration of all the different circumstances that are happening at a location, and they'll either ask for a voluntary or an involuntary transport to our local emergency room so that a therapist can talk with them. And I say, let's cut down that time. Let's bring that therapist out into the field and have that connection where that person is in crisis to try to alleviate some of the issues with having a law enforcement response, all those different things, but also wanting to make sure that our community is safe and our social workers, our therapists are safe. Because some of these scenes clearly have a volatile, violent connection, and let's make sure that we just provide what we can provide as deputy sheriffs for safety, bring a clinician out in the field, and just try to streamline that service for the entire community here in Northern California.
Sheriff, on January 1st, as you know, deputies from your department, along with police from the city of Grass Valley, responded to a call about a man walking around with a shotgun. He was then shot dead when he ignored commands to drop the weapon. It turns out he was well known to authorities as someone who had mental health problems and had talked about committing so-called suicide by cop and owned guns. Are there any lessons from that tragedy going into this new program?
Yeah, extreme tragedy here that affected everyone in our community, and we're still going through that investigation. We're still waiting for some of the results from our district attorney's office. But what I will say is, the staff that we have at the sheriff's office and the police officers in our region really do go out and try to make sure that they're allowing that safety for our community. This particular program may or may not be even a place for that type of a call, because again, people sometimes with the violence, with firearms, with all those different things, it is difficult. We want to make sure those scenes are safe before a therapist or a clinician comes into a situation. It just adds that another layer and another service to the community.
So you mentioned that the way it works now is an officer may go to a scene, and then if they sort of determine that a therapist would be better able to handle it, then they call the therapist in. So this program would change it so that the therapist and the police officer would be there at the same time, and so that mental health intervention would happen more quickly, more immediately. Does that mean that you have... Oh, sorry, go ahead. You can clarify if I'm getting it wrong.
No, it's all right. It's just, when when the 911 caller or the call taker in our dispatch center receiving a lot of that information and trying to get as much information about the volatility or the violence at a scene. A lot of times we get calls for service of a welfare check from a family member that may not have any firearms or weapons involved. And it's, hey, my loved one is not having a great day, maybe got an email or a text about ending their life. Can you go do a welfare check on that person? That's a clear case for where a therapist going to someone, not having to be just having a law enforcement officer respond, asking them and providing a transportation to an ER. All those things I think can much more effectively be serviced with a clinician going to a residence and seeing someone where they are.
Okay, so I know that this is a pilot project, so whenever you get pilot projects, get a little extra funding so you can, see how it works. Moving forward, if it turns out to be a success, I mean, how would something like this be funded? Would these therapists be employees of the police department, or I don't know, some other sort of element of the city, or how does it happen going forward? It seems like it might be expensive.
Yeah, it is. The reality is that connection with behavioral health is certainly important, to have someone within that behavioral health that has the data, has a lot of the contact information. A lot of times this is repeat folks that are having challenges out in the community. But having that connection, the funding piece, where it stands today as a pilot project, this is being funded by the sheriff's office. So I've got a deputy sheriff using from my existing services, and then we're going to contract through behavioral health for that clinician piece. So looking at data, that's the important thing, is really looking at what that outcome is going to be. And if the outcomes are what we believe them to be, as that efficiency, freeing up the deputies' time so deputies can be out in the field doing response to violent crime and criminal investigations, not having all of the time spent in the emergency rooms where people are sick and needing services from our emergency room staff, I think is also a benefit. But looking at those outcomes and then looking at maybe some of that grant funding that's out there. This is definitely the way in which we're going to start seeing a lot of agencies shift to. I just wanted to get a little bit out in front of it and try and do this pilot to see what our outcomes would be, so then that we could shift based on what we see here in the community. We're seeing this all up and down, not just in California, across the Midwest. San Diego is a pure example of a program that's been in place for decades on psychiatric emergency response. Santa Barbara has some phenomenal teams doing behavioral health work at the law enforcement level. All again, just giving the deputy sheriffs and the police officers the ability to stay focused on their mission, and then bringing in a service. We're starting to see in the Bay Area, San Francisco came out. They're taking off the dual response, and they're just going to have therapists in the field. Since that's a new thing, I'd rather see us go slow, try to look at the safety measures for our deputies, for the community, and for therapists.
Yeah, I think what we might be seeing is an evolution in policing. I'm sure you don't want to go down the whole defund the police rabbit hole, but that conversation is about how do you use police in the best way for the community, and are there other people who could do some of the stuff that's landed in the lap of our police force that really, that's not what they were initially there to do. They do the job, but there are other people who can do it as well, and they should, and all these various specialties should be working together to serve and protect the community. I think it's really fascinating what's happening there in Nevada County. Sheriff Shannon Moon, thank you so much.
Absolutely. Thank you so much again for having me.
So listen, if you or someone you know is struggling with suicidal thoughts or emotional distress, call the number that you see on your screen. It's 1-800-273-TALK. The National Suicide Prevention Lifeline is free. It's available 24 hours a day, 7 days a week.